Imagine for a second, sitting on that crinkly paper covering an examination table.
Oh, yeah, we all know that terrible sound.
Right. It's iconic in the worst way. And you went in because of a persistent cough. Nothing crazy,
It's
right?
just a tickle in the back of your throat.
Exactly. Just
Yeah.
a tickle that just wouldn't go away. And the doctor walks in, looks at a scan, and delivers the news: lung cancer.
It's just absolute terror in that moment.
Total terror. But before you can even process that diagnosis, the very next question out of the doctor's mouth or your friend's mouth or your coworker's mouth is almost always the exact same thing.
Yep. They ask, how long did you smoke?
How long did you smoke? Exactly. But what if you never touched a cigarette in your entire life?
What if you're like a marathon runner, you know?
Right. Suddenly you aren't just a patient fighting for your life. You're a suspect undergoing an interrogation.
And that immediate jump to a behavioral cause, that interrogation, like you said, is a phenomenon entirely unique to this specific disease.
It really is. I mean, if you are diagnosed with, say, breast cancer or leukemia, society just wraps you in a blanket of absolute empathy.
Oh, absolutely. There are casseroles, fundraisers, unquestioned support.
Yeah, but with lung cancer, society just throws up this wall of implicit judgment.
There is this immediate assumption of guilt, an assumption that this is a self-inflicted wound.
And that judgment doesn't just hurt feelings, right?
No, not at all.
Yeah.
It actively dictates medical timelines, it isolates patients, and it suppresses literally billions of dollars in vital research funding.
Which is exactly what we are unpacking in today's deep dive. We are looking at excerpts from the document, The White Ribbon: Breaking Stigma and Advancing Lung Cancer Awareness.
It's such an incredibly important piece of source material.
It really is, because
Yeah.
we're looking at the deadliest cancer on the planet. And more importantly, we are looking at how a simple piece of fabric, a white or pearl-colored ribbon, is being deployed as a weapon.
A weapon to dismantle that toxic blame game.
Exactly. So our mission for the next hour is to figure out the mechanics of this disease, both biologically and socially.
We really need to understand those invisible causes that nobody talks about.
Right. And the cutting-edge science that is finally offering some hope, and what this all means for you, whether you've been personally impacted by this or you just want to understand the hidden forces shaping global health.
Because the scale of this issue, it really cannot be overstated.
Okay, let's unpack this,
Yeah.
because the scale is massive.
Huge. We are talking about the leading cause of cancer-related deaths worldwide.
Worldwide.
Yeah, it eclipses breast, colon, and prostate cancers combined in terms of mortality.
Wait, combined. All three of those combined.
Yes, combined, and it cuts across every demographic line. We try to draw age, gender, background.
See, when you hear leading cause of global cancer deaths, I think human nature tries to compartmentalize that threat.
Oh, definitely. We want to put it in a box so we can, assess our own personal risk and feel safe.
Right? Like, I don't smoke, so I'm safe in my box. But the reality just completely shatters that box. Millions are affected, and the threat is incredibly indiscriminate.
It is, which is why the symbol itself is so important.
Right, the banner matters. When you're fighting a beast that massive, you need a good banner.
Yeah.
And for this global crisis, the chosen symbol is the white or pearl awareness ribbon.
Yes, and people might wonder, why those colors?
Yeah, because if you look at the landscape of cause marketing, you have pink for breast cancer, which kind of evokes traditional femininity and a desire to protect.
And you have bold red for heart disease or HIV, which signals urgency, blood, immediate action.
Right. But white feels, I don't know, it feels quiet.
It does feel quiet, but it is actually deeply strategic.
How so?
Well, white and pearl symbolize clarity and truth. Historically, lung cancer has existed in a very murky, judgmental shadow.
Ah, clouded by the tobacco industry.
Exactly. Clouded by the tobacco industry's history and public health campaigns that aggressively link the lungs exclusively to smoking.
So choosing white is like a deliberate counter-movement.
It is. It represents a blank slate. It is an attempt to wash away the preconceived notions and illuminate the actual reality of the disease.
Which is highly complex and largely misunderstood by the general public. But let me challenge the effectiveness of that for a second.
Sure.
Because we live in an incredibly saturated attention economy, Ribbons, wristbands, bumper stickers, they are just everywhere.
They really are. It can start to feel like passive aesthetic noise.
Yeah. Pinning a piece of white fabric to your lapel feels a bit like, I don't know, putting a Save the Whales bumper sticker on a car with a broken engine.
I see what you're saying.
Like, it shows you care, sure, but does it actually change the mechanical reality of a deadly global disease?
Well, what's fascinating here is that you have to consider the psychological barrier this specific ribbon is trying to break.
Okay, tell me more.
This isn't just about awareness in the sense of letting people know lung cancer exists. I mean, everyone knows it
Right,
exists.
it's not a secret.
Exactly. The white ribbon is actively deployed to dismantle a unique social stigma. When an individual wears that ribbon, they are taking a very deliberate, active posture against the blame game.
Oh, I see. They are signaling total inclusivity.
Yes, demanding compassion and support for smokers and non-smokers alike. It's a refusal to participate in the traditional hierarchy of innocence that society tries to apply to cancer patients.
Wow. Hierarchy of innocence. That is a powerful phrase. So it's less of a bumper sticker and more of a protest sign.
Exactly. You are actively protesting the caveat of, did they smoke?
And that protest is vital because, as the source material points out, that caveat is deadly.
It is incredibly deadly. Let's look at the mechanics of this self-inflicted myth.
Yeah, let's break that down.
For decades, the public health messaging correctly identified smoking as a major risk factor.
Right, which it is.
It is. But the unintended consequence of that aggressive messaging was a societal short circuit. People began to believe smoking was the only cause.
Which brings us to the hidden threats, right? The non-smoking causes that completely dismantle this whole self-inflicted myth.
Right. We have genetic predisposition, radon gas, air pollution, secondhand smoke, and occupational hazards like asbestos.
Let's get into the how of these, because I think a lot of people hear radon or asbestos, and they sound like, buzzwords from a late-night infomercial lawsuit.
Yeah, the If You're a Loved One commercials.
Exactly. They don't sound like an immediate biological threat. So how does a colorless gas in your basement actually give you lung cancer?
Well, the mechanics of radon are actually terrifying when you really break them down.
Terrify me.
Okay, radon is a naturally occurring radioactive gas.
Wait, radioactive, just naturally?
Yes, it comes from the normal, everyday breakdown of uranium in soil and rock.
Okay.
It seeps up through the ground and can get trapped in homes, particularly in basements or, poorly ventilated lower levels.
And you can't see it, smell it, or taste it.
Exactly. You're just breathing it in while sitting on your couch watching TV.
That is deeply unsettling.
It gets worse. Continually breathing it in means the radon gas decays into radioactive particles that get trapped deep in your lungs.
Oh, wow.
And as these particles continue to break down, they release tiny bursts of energy. Alpha radiation.
So you have radiation physically striking the inside of your lungs?
Yes. It physically strikes the DNA inside your lung cells. It's like microscopic bullets snapping the double helix of your genetic code.
That is a crazy visual. Microscopic bullets.
And over time, that repeated structural damage causes the cells to mutate and multiply uncontrollably.
Yeah.
That is cancer.
And it happens completely independent of whether you've ever even touched a cigarette.
Exactly.
And asbestos operates on a similar level of, microscopic physical damage, right? It's not a chemical poisoning, it's a structural weapon.
Precisely.
Yeah.
Asbestos is composed of these, but when those materials degrade, the fibers become airborne. When inhaled, these tiny indestructible needles lodge themselves deep into the lining of the lungs, the pleura.
So they just get stuck there.
Yes. And your body's immune system sends white blood cells to destroy the invader. But because the fibers are mineral, the immune system can't break them down.
It's like trying to dissolve a rock with white blood cells.
Exactly. It doesn't work.
Mhm.
This leads to decades of chronic, localized inflammation and scarring, which eventually triggers the cellular mutations that lead to mesothelioma or lung cancer.
Okay, so let's say you happen to move into a house built on uranium-rich soil, or you work in an industry that used asbestos before it was heavily regulated.
Or you simply live in an urban center with heavy particulate air pollution.
Right. Your risk profile changes entirely, your DNA is taking damage, and it has absolutely nothing to do with your personal choices.
Yet, because of the overwhelming stigma we were talking about, a patient who develops a tumor from radon exposure is still hit with the assumption that they brought it on themselves.
Which is just so unfair. But let me play devil's advocate for a second.
Go for it.
If we aggressively highlight the non-smoking causes just to avoid the stigma, do we accidentally reinforce the idea that smokers do deserve their diagnosis?
That is a brilliant question, and it's a trap we have to be very careful to avoid.
Right, because nobody deserves cancer.
Exactly. The source text insists on compassion, understanding, and support for all affected.
All affected, not just the innocent ones.
Right. The white ribbon represents inclusivity. No one's story should be overshadowed, and no one should be punished for an addiction that is notoriously difficult to break, often started when they were teenagers.
That makes total sense. And the psychological toll of that stigma is just profound.
It actively isolates patients. When a disease is viewed as a choice, the natural wellspring of public empathy just dries up.
And patients internalize that, don't they?
They do. They feel shame. They hide their diagnosis from friends and extended family just to avoid the judgment.
Let's follow that logic to its darkest conclusion, though. Because guilt and shame don't just hurt your feelings.
No, they are medically dangerous.
Right. If you are a non-smoker and society has hammered into your brain that lung cancer is a smoker's disease, then when you develop a persistent cough, lung cancer isn't even on your radar.
You rationalize it.
Exactly. You tell yourself it's lingering allergies or a slow recovery from a cold.
You delay going to the doctor because you just don't fit the cultural profile of the disease.
And here's where it gets really interesting, or rather, really tragic. That psychological delay provides the exact runway the biology of this cancer needs to become fatal.
The clinical timeline is ruthless.
It really is. By the time the psychological hurdles are cleared and a patient finally seeks medical help, the biological reality is often advanced way beyond the point of easy intervention.
Which is why we need to talk about that biology, because lung cancer isn't just one monolithic enemy.
Right. It behaves differently depending on what variant we're looking at. The source text mentions two primary types.
Yes. Non-small cell lung cancer, or NSCLC, and small cell lung cancer, or SCLC.
Okay, what is the actual mechanical difference operating inside the patient's chest here?
The distinction really comes down to the origin of the cells and how rapidly they divide.
Okay, let's start with NSCLC.
Non-small cell lung cancer is the more common type, accounting for roughly 80 to 85% of cases.
So the vast majority.
Yes, it originates in the epithelial cells, the cells lining the airways and the glands of the lungs. It tends to grow and spread more slowly.
Okay, so it's a slower mover. What about the other one? Small cell lung cancer.
Small cell lung cancer is a completely different beast. It often originates in the neuroendocrine cells of the lung.
Neuroendocrine, meaning cells that act like nerve cells and release hormones.
Exactly. And because of their biological nature, these SCLC cells have a terrifying capacity for rapid division and early metastasis.
Early metastasis, meaning it spreads quickly to other parts of the body.
Very quickly. By the time a primary tumor is even detectable in the lung, microscopic clones of that cancer have often already hitchhiked through the bloodstream or lymphatic system to the brain, liver, or bones.
Wow, so it's already everywhere before you even know it's anywhere.
Exactly. This rapid growth means oncologists have to approach SCLC with incredibly aggressive systemic treatments immediately. There's no time to wait.
But here's the truly insidious part, regardless of whether it's the slower NSCLC or the aggressive SCLC. The symptoms themselves are practically designed to be ignored.
They really are.
We are talking about persistent coughing, chest pain, shortness of breath, unexplained weight loss.
Aside from coughing up blood, which is an obvious five-alarm fire,
Right.
the rest of those are just the background noise of being an adult.
Right. The subtlety is the core danger. And there is an anatomical reason for this, isn't there?
Yes, the lungs themselves have very few pain receptors inside the tissue.
Wait, really? So you don't feel it?
No, you don't actually feel a tumor growing in the soft tissue of the lung the way you might feel a lump under the skin or a sharp pain in a muscle.
I always think of it like a house settling.
Oh, that's a good analogy.
You know, you buy an older house and it makes noises. There's a creak in the floorboards, a draft around a window, maybe a door starts sticking in the summer.
And you just ignore it.
Exactly. You ignore it. It's just the house aging. You are a little short of breath walking up the stairs. Well, you're getting older or you're out of shape.
You have a lingering cough. It's just allergy season.
Right. You rationalize the creaks and drafts until one day you realize the foundation is fundamentally cracked.
And returning to the anatomical reality, by the time the tumor has grown large enough to press against the chest wall where there are pain receptors, or it has grown large enough to physically obstruct a major airway, causing severe shortness of breath,
It's too late.
it is usually quite large and often very advanced. Relying on physical symptoms to prompt a doctor's visit is essentially waiting until the disease has already won the first half of the battle.
Which pivots us to the absolute necessity of bypassing the symptoms entirely.
Yes.
We have to look at the foundation before the floorboards start creaking. And that is where low-dose computed tomography comes in.
The LDCT scan.
The LDCT scan. This is highly recommended for individuals at high risk. But again, let's break down the mechanics. Why an LDCT and not just a standard chest x-ray?
It's a great question.
Because I go to the dentist, I get an x-ray, they see the cavity perfectly fine. Why doesn't that work for the lungs?
Well, a traditional chest X-ray is essentially a two-dimensional shadow.
Okay.
It takes a 3D object, your chest cavity,
Mhm.
filled with the heart, ribs, spine, blood vessels, and lungs, and flattens it onto a single plane.
Right, everything is squished together on the image.
Exactly. So small tumors, especially those the size of a grain of rice or a pea,
Mhm.
can easily be obscured by the dense white shadow of a rib bone or the heart muscle.
It's like trying to find a specific marble in a jar by only looking at the silhouette of the jar cast on a wall.
That is exactly what it's like. But an LDCT scan operates entirely differently. The patient lies on a table that slides into a donut-shaped machine. The X-ray tube inside spirals continuously around the patient, taking hundreds of cross-sectional images in a matter of seconds.
Oh, wow.
A computer then stitches these slices together to create a highly detailed 3D model of the lungs.
So the doctor can virtually walk through the lungs.
They could look at slices of tissue just millimeters thick.
Yeah.
This allows them to spot microscopic nodules, those grain of rice-sized abnormalities, long before they cause a single symptom.
Long before they hit a pain receptor.
And critically, before they have a chance to metastasize and spread, finding a localized stage 1 tumor on an LDCT scan changes the survival probability from a long shot to highly curable.
If we connect this to the bigger picture, that is the exact vigilance the White Ribbon is calling for. It is a demand for proactive healthcare.
Absolutely.
But what happens if the scan does find something? This brings us to a massive shift in the narrative.
A very hopeful shift.
Yes, because we've spent a lot of time on the grim realities, the fast-spreading biology, the subtle symptoms, the isolating stigma. But there is an incredible science of hope developing right now.
The landscape of survivorship is changing rapidly due to medical breakthroughs.
Let's talk about those breakthroughs, because the shift over the last decade has been nothing short of revolutionary, right?
It really has. For a long time, the standard of care was heavily reliant on traditional chemotherapy, which is systemic.
Meaning it affects the whole system.
Right. Chemotherapy essentially targets any rapidly dividing cell in the body. It doesn't discriminate well between a rapidly dividing cancer cell and a rapidly dividing healthy cell,
Right.
like your hair follicles or the lining of your stomach.
It's a blunt instrument.
Very blunt.
It's like finding a termite infestation in your living room wall and deciding the best solution is to just pump the entire house full of poison, hoping the termites die before the structural beams rot away.
A grim but very accurate way to visualize it.
Mm-hmm.
But the breakthroughs in targeted therapies have fundamentally changed that approach.
Targeted therapies, how are they different?
Well, targeted therapies don't just look for rapidly dividing cells. They look for the specific genetic misprints that are driving the cancer's growth.
Oh, fascinating.
When a patient is diagnosed now, their tumor is often biopsied and genetically sequenced.
Let's use the mechanic analogy here.
Right.
Imagine the cancer cell is a rogue factory churning out copies of itself. The mutation driving it is a specific broken switch stuck in the omen position.
I like this.
Traditional chemo bombs the entire factory and the healthy factories next door. But targeted therapy is like sending in a highly specialized mechanic who only knows how to do one thing. Snip the wire to that exact broken switch.
That is exactly how it works. Once that switch is snipped, the factory shuts down.
Wow.
The tumor stops growing and often shrinks dramatically. And these drugs are usually pills taken at home, bypassing the grueling physical toll of intravenous chemotherapy.
That is a massive improvement in quality of life. But the innovation doesn't stop there, does it?
No, it doesn't. We also have to discuss immunotherapy, which is arguably an even more profound philosophical shift in oncology.
Immunotherapy, enhancing the body's natural defenses.
Yes.
But how does it actually work? Because our immune systems are supposed to fight off disease naturally. White blood cells attack viruses and bacteria constantly.
Right.
So why do they just ignore a growing lung tumor?
Because cancer cells are incredibly deceptive. They originate from your own body, so they don't look like foreign invaders to the immune system.
They blend in.
Exactly. Furthermore, many lung cancers evolve a specific defense mechanism. They produce proteins on their surface that act like an invisibility cloak or like a secret handshake.
A secret handshake.
Yeah. When a T cell, which is your immune system's attack dog, comes up to the cancer cell to inspect it, the cancer cell uses this protein to essentially shake hands and say, nothing to see here, I'm a healthy cell.
And the T cell just falls for it.
It falls for it. The T cell moves on, and the tumor continues to grow completely unbothered.
It literally tricks the immune system into standing down.
Yeah.
That is wild.
It is. So, what immunotherapy drugs do, specifically checkpoint inhibitors, is they strip away that invisibility cloak.
They block the handshake.
They block that deceptive handshake. Suddenly, the T cells can clearly see the cancer cells for the lethal threat they actually are.
Wow.
It unleashes the patient's own immune system to attack and destroy the tumor. We are turning the body into its own most potent defense mechanism.
That is just incredible. We are shifting from attacking the cancer with outside weapons to simply giving the body the intel it needs to fight the war itself.
Exactly.
But here's the roadblock, and it loops us right back to the beginning of our conversation.
The funding.
The funding. These breakthroughs, sequencing tumors, developing highly specific mechanic drugs, engineering checkpoint inhibitors, they require billions of dollars in research and development.
And lung cancer research is historically underfunded compared to other major cancers.
The funding disparity is a direct, measurable consequence of the stigma we discussed, isn't it?
Yes, it is. There is a literal economic price tag on societal empathy.
That is a depressing thought.
It is, but it's true. For decades, both private philanthropy and public grant allocations subtly reflected this self-inflicted bias.
Right. When the general public views a disease as the tragic result of a bad habit, the financial urgency to cure it just plummets.
Exactly. Stigma has literally starved a life-saving scientific field the capital it needs.
Which completely reframes the purpose of the white ribbon for me.
How so?
Well, when an advocacy group pushes to break the stigma, they aren't just trying to make patients feel better emotionally, right?
Yeah.
It is an economic imperative. Breaking the stigma unlocks empathy. Empathy unlocks research dollars. Research dollars unlock immunotherapies. Immunotherapies unlock survival.
You nailed it. And the mechanism used to generate that empathy is human storytelling.
Human faces change minds.
Exactly. Statistics don't move the needle on public perception. You can tell someone that millions die globally, and the human brain just processes it as abstract math.
It's too big to comprehend.
But survivorship stories provide a tangible anchor. When you see a face, a mother, a teacher, a non-smoker, or even a long-term smoker who has battled this disease and is now living a fulfilling life thanks to a targeted therapy, it shatters the misconceptions.
Data doesn't change minds. Human faces do. They prove that the disease affects real people, not just data points. And they prove that survival is possible.
It's a crucial part of the movement.
But we have to acknowledge the heavy reality that despite these advancements, the mortality rate is still just staggering.
It is. We have a long way to go.
Surviving the disease is one part of the narrative, but a massive part of this cultural movement is about how we honor the millions who haven't survived.
Yes, and the mourning process for a highly stigmatized disease is uniquely complicated.
I can imagine.
When someone dies of a culturally acceptable disease, the community rushes in. But with lung cancer, families often feel a pressure to hide the actual cause of death.
Because they want to protect their loved one's legacy.
Right. They want to protect them from that inevitable judgmental question of, did they smoke?
And that pressure to hide the truth essentially forces families to grieve in a vacuum. It strips them of communal support.
Which is devastating.
This transitions us into the critical role of memorialization, tribute, and community. Because fighting back against that forced silence requires tangible tools.
It does.
The white or pearl ribbon isn't just for clinical advocacy. It holds deep emotional significance as a symbol of remembrance.
This is where physical, customizable tokens become incredibly important. Organizations that provide these materials play a vital role.
Right. The source text explicitly highlights this. For example, the funeral program site is a major provider in this space.
Yes, they offer a wide range of ready-to-wear, customizable lung cancer awareness ribbons.
They provide the actual physical artifacts that families need to manifest their grief publicly.
Exactly.
Let's dig into the psychology of that. Why does a physical ribbon matter? Why go to a place like the funeral program site to order a customized piece of fabric?
It's a great question.
To me, it touches on the psychological concept of continuing bonds. When someone dies, the relationship doesn't end. It just changes form, you know?
Yes, beautifully said.
Taking a generic medical symbol, a plain white ribbon, and customizing it with a name, a date, or a special message transforms it.
It's no longer just about lung cancer.
Right. It is a specific, deeply personal artifact of a unique human life.
That transformation is essential for healing. When a grieving daughter pins a customized ribbon to her lapel for a memorial service, or maybe a celebration of life, she is pulling her grief out of the invisible internal realm and making it physical.
It provides comfort, a sense of continuity.
But crucially, in the context of lung cancer, it is also a quiet, defiant act of public advocacy.
Defiant is the perfect word.
When a family refuses to hide the cause of death, when they proudly wear that white ribbon with their loved one's name on it, they are directly challenging the stigma.
They are publicly declaring, my loved one died of this disease, their life held immense value, and I refuse to be ashamed.
It is public mourning as a form of social protest.
Wow. And that individual defiance scales up into community solidarity, doesn't it?
It absolutely does. We see this through support groups, counseling networks, awareness walks, and fundraising campaigns.
So what does this all mean? When you organize a 5K walk and hundreds of people show up wearing those custom white ribbons, what is actually happening on a sociological level?
You are creating a physical safe zone where the stigma cannot enter.
I love that. A safe zone.
A lung cancer diagnosis or a death in the family from it is profoundly isolating. A community event actively strips away that isolation.
It connects individuals who thought they were suffering alone.
Yes, it shifts the heavy emotional burden from the shoulders of the isolated individual onto a broader, structurally sound support network. It fosters open conversations without fear of judgment.
And practically speaking, those walks and community events are doing double duty.
Because of the fundraising.
Right. They provide the emotional scaffolding for the grieving, but they also raise the capital needed to fund the research we talked about earlier. They fuel the science of hope.
Which leads us directly to the future of this movement.
Let's look forward.
Community support is the foundation, but to truly alter the global trajectory of lung cancer, we need systemic top-down change. And that requires relentless advocacy.
So the white ribbon isn't just asking for better drugs. It is a symbol demanding comprehensive public health initiatives.
Yes, it is a multi-front war.
If we go back to the non-smoking causes radon, asbestos, air pollution advocacy means fighting for environmental policy, right?
Exactly. It means pushing for stricter workplace safety regulations so construction workers aren't inhaling microscopic mineral needles.
It means demanding better urban planning to reduce the particulate matter in the air we all breathe.
It requires a holistic view of human health. Yes, anti-smoking campaigns remain absolutely critical because tobacco use is still a primary driver of the genetic mutations that cause the disease.
Obviously.
But public health policies must simultaneously address the environmental and occupational hazards. We have to regulate the air quality just as aggressively as we regulate tobacco products.
It's incredible. The white ribbon is ultimately doing a lot of heavy lifting.
It really is.
It is demanding political action on the environment. It is demanding massive financial investments in personalized oncology and early detection screening programs. And fundamentally, it is demanding a profound shift in social empathy.
The future outlined by these advocacy movements relies heavily on expanding access to care. We need to get those LDCT scans to rural and underserved populations, not just those in major metropolitan hubs.
Access is everything.
It is. We need to continue funding the research that allows treatments to be tailored to the exact genetic makeup of an individual patient's tumor. The ultimate goal is a future where the disease is not just more effectively treated, but fundamentally better understood and prevented.
So what does this mean for you listening right now? The ultimate takeaway is a call to become the primary advocate for your own biology.
Self-advocacy is key.
Support the broader public health policies, absolutely. But on a personal level, you have to prioritize regular checkups. You have to know your own specific risk factors.
Have you tested your basement for radon? Do you have a family history that might suggest a genetic predisposition?
Right. Do not ignore the creaking floorboards of your own house just because society told you that you don't fit the profile of the disease.
Be hypervigilant. If you have a persistent symptom, demand answers.
And most importantly, approach this disease, whether evaluating your own health or reacting to the diagnosis of a friend, colleague, or stranger, with the clarity and truth that the white ribbon was designed to represent.
Leave the assumptions and the interrogations at the door.
What a profound journey this deep dive has been. We started by confronting the staggering global mortality statistics and the immediate, isolating interrogation of this self-inflicted stigma trap.
We covered a lot of ground.
We did. We broke down the invisible mechanical threats of radon gas and microscopic asbestos fibers that completely shatter the smoker-only myth.
And we explored the ruthless biology of rapid dividing SCLC and the subtle, insidious nature of the symptoms.
Right, understanding exactly why early detection through 3D LDCT scans is the only way to beat the clock.
And the science of hope, too.
Yes, we looked at the awe-inspiring science of targeted therapies, snipping genetic wires and immunotherapies, unmasking tumors to the body's own defense systems.
And we spent crucial time understanding how tangible memorialization customized ribbons from providers like the funeral program site transforms private grief into public, stigma-defying advocacy. It is a perfect example of how medicine does not exist in a vacuum. It intersects heavily with psychology, sociology, and economics.
It really does.
And I want to leave you with a final thought to really mull over.
Okay, what is it?
We've seen today, clearly and measurably, how a societal stigma, a collective moral judgment, can suppress billions of dollars in federal research funding and delay life-saving diagnoses for decades.
Yes, the economic cost of stigma.
It forces us to ask a very uncomfortable question. What other areas of human health, what other medical crises or societal challenges are currently being starved of progress, not because we lack the technology or the scientific brilliance, but entirely because of our own collective judgments?
Wow, that is the thought to take with you. How many cures for how many diseases are currently trapped behind a wall of societal shame?
Something to think about.
Thank you for joining us on this deep dive. Stay insanely curious. Keep questioning the narratives and the symbols around you. And remember that sometimes a color isn't just a color. Sometimes a white ribbon is a literal demand for truth, for clarity, and for survival.